So in terms of training new healthcare providers, do you see changes that you're thinking about in the short and the long term that you've learned from this?
I am a giant advocate of clinical bedside care because when I trained back in the day, we had at least 3 days of clinical every week in the hospital, acute care setting. And then
From the get-go? Or?
yeah, from the first year. My program was 3 years long at the time to get my RN, and we had really intensive clinical training, and it was amazing, and I support it wholeheartedly. I think the problem we faced with this crisis was unique. One, no one knew what COVID was capable of. No one knew what it was going to do, whether we saw what it affected a skilled nursing facility in Seattle, and we studied that. Then we were getting directives from the governor and others that said no more visitors. So that the directive from the state governor's office and the Department of Public Health, we had to eliminate all visitors, and that was not the choice of providers, certainly not something we wanted to do. And so is a student nurse a visitor, is a student nurse a staff member? There was some confusion with that. And then something that we all need to talk about, the PPE issue.
Okay.
We've seen price gouging, horrendous, 1,000% markups, even to today. And so early on,
1,000% markups?
1,000% markups, still going on. So when this first started 5 months ago or so, there wasn't enough PPE then. And we were trying to get PPE. The state of Connecticut at that point had not assisted us in trying to get PPE because they were just like us trying to figure out what's going on, how can we fight this together. But getting PPE was difficult, number one. Number two, the quality of the PPE necessary, like N95 masks. If there were companies out there selling masks that are,
N95 masks.
this is Kingfa, and it's a KN95. Well, early on, the CDC says these are not N95s. They're not approved for COVID. But then 2 months later, when the government started assisting us getting PPE, they shipped us thousands of these. So then there must have been a change somewhere. We used to pay 30 or 45 cents for a disposable gown, yellow paper gown,
Right.
which would protect the patient, the employee, and the patient. Soon that went to $10, then to $14.
From the same companies?
From the same manufacturer. I'm not sure. We're buying from any company we can. I have to say there are companies we're buying from to guarantee the protection of our patients and our staff. Companies we've never done business with because we had no choice. And there are vendors, and we were buying actually to help hospitals. Our purchasing department and our company was actually helping acute care hospitals because they couldn't get the product. So that was part of the challenge. Would we have had enough PPE to protect the students? There were so many things going on that it was really hand-to-hand combat in the healthcare industry. And we love students. I'm a big advocate. We love having them in the building. Nothing like their assistants and with their instructors who are so knowledgeable. And we're excited to get them back as soon as possible. But this was an unknown, and so many things happened so quickly, from the shortage of PPE to the lack of understanding. There was not even a COVID test early on that 5 months ago that would have told us, now you can get a COVID test and the next day you know if you have COVID or you don't. Also, we were getting patients from the hospital. They said, oh, this patient doesn't have COVID. Patient comes in, they have a fever.
There are so many variables,
Right.
and still,
And
now
still,
they say some
so-
of the tests are false positives, and they're
Right.
working on the vaccine.
You
and
saw that the other day, 90
it's like a
false
tsunami
positives.
that's coming slowly. We had no idea. We can't
Correct.
prepare,
Right.
and so all of us are dealing with so many things.
Right.
And it's bringing out issues that were there, and now they're glaring.
Yes.
That's what it sounds
Yes.
like. I'd like to shift to mental health a little bit. And that covers everything from SMI, serious mental illness, to just anxiety over being unemployed. So But duration of the virus, the related financial crisis, high unemployment rates, and those with serious mental illnesses not getting the attention, which, as the mother of someone with one, I will tell you, was scarce to begin with, or scant to
Yes.
begin with. What is your take on the effects on mental health and the care of those with mental health needs with regards to this crisis?
It is the greatest weakness in the healthcare industry. Clearly, the mental health situation in this country, and specifically Connecticut. I remember when Governor Lowell Weicker closed down all the institutions, majority of them, I won't say all, the crisis that wrought on society. You know, prescribing medication isn't the total solution. People do need therapy. They need to talk. Sometimes they need to be institutionalized, at least for a period.
And they need supervision
And
for
they-
the medication
Yes.
because they may not think they need it.
Correct.
And so
when
that,
you're feeling
yeah.
better, you're taking your meds, you're feeling better. Oh, I'm not going to take the meds. I'm fine.
Right.
We have mental health issues in our family as well. Most families do, if they're honest.
Yeah.
I'm sure I do.
Or at least 1 out of 4
Right.
is the statistic.
Right. So the COVID crisis really magnified the weakness in our healthcare system regarding mental health. I heard at one of our previous meetings, people frustrated, they go into the grocery store, I'm not wearing this mask, they're screaming. Well, what they're really saying is, I'm tired of it, I can't take it anymore, and I know I should wear it, but I'm losing it. And a lot of people are losing it. I think we've seen crime rates escalate. We've certainly seen gun permits and gun sales go through the roof. Record sales, record gun. You can't even go into a police station without an appointment now to get a gun permit. So people are scared, people are frightened, and it's our mental health. And sometimes the media is making it worse. And that is, I don't want to keep attacking the media, but clearly they're not helping when they just want to give you bad news because they know they're going to get better ratings. And there are people watching that who have nothing else to do, as you mentioned, they're unemployed. And they're in lockdown, and they're being fed this all day long and getting more and more anxious. And it's tragic because the suicide rate, the suicide hotlines are burning up. So you brought on a great point. First of all, the system was broken before, and now it's completely broken. So I think that is a change going forward that as a good citizen, we can all hope and talk to our legislators and our senators. It is a political solution, unfortunately. It has to be, because
It's definitely funding involved.
funding is key. Yes.